What I want to do today very quickly is to go through 13 stages of telehealth. So let's go on to the first stage. This is where almost everybody is, where the field has been. This is asynchronous and synchronous telehealth, which is really telephone or video visits. Second stage, of course, is expanding it beyond those episodic and urgent visits to really including specialty care, creating primary care models of telehealth, creating telebehavioral healthcare models, and then adding other things like physical therapy, virtual physical therapy, even teledental care. Stage 3 becomes a little bit more of an advanced model. We're beginning to see this now in different parts of the healthcare ecosystem. This is really chronic care management using telehealth. But more importantly, I would call it team-based care. This is where it's not just a single practitioner that is providing the care, but it really is the nurse, the doctor, the dietitian, the psychologist, the social worker, the pharmacist, all providing a coordinated care approach and using telehealth in a chronic care disease management model. Stage 4, of course, is device and technology integration, being able to expand the video visit and the communication tool to actually getting physical information by doing an examination. This is where, frankly, I fell in love with TytoCare, because being able to do this in a way of getting the physical exam information, auscultation of the heart, the lungs, the abdomen, being able to do that. I'm a primary care doctor and I've been using telehealth to treat veterans. This really is a new stage in the development of telehealth. Stage 5, really, this was the aha for me with TytoCare. So TytoCare brings you to stage 5, and that is that if you take a look at this picture at the top, this is when I wanted to bring to the White House my ability to deliver telehealth to veterans. I sought the president's help in getting some federal relief in expanding our use of telehealth in the VA system. But look at all that equipment that I had to bring into the Roosevelt room of the West Wing. So when I saw the TytoCare tool, it actually is self-directed care, using videos and using sort of the tools that point you to either getting the tympanic membrane or where to place the TytoCare device to be able to hear a good heart sound, an S1 or an S2, or hear auscultation. It actually allows a patient or a parent to self-direct this care. The next stage of where I think healthcare in telehealth is going, and that is that it's not just the physician collecting information and listening to the patient, but it's actually providing decision support to allow them to know what might be a next step or what information might be important in order to being able to really deliver a better quality care session. Let's go to stage 7. Interoperability of data with the community. So important with telehealth. Telehealth often reaches into a patient's home, into a workplace, into settings on a mobile phone. But how do you actually integrate the information on the telehealth visit with the acute care settings, with pre-hospital care, with long-term care, with ambulatory care, and devices, whether they're collecting information or not? This is really requiring the true interoperability of data to get all of that information available to the clinician, to the patient, to the teams that are caring for the patient getting the telehealth visit. And so I think that's stage 7. Let's go on to stage 8. Transparency and gaps in care. The telehealth systems in stage 8 will be providing specific information about assessments of care, so patients can assess where they are in their chronic diseases and their acute care. Stage 9, please. This is what's really important today. If you're using a telehealth encounter, you typically will either get the next provider who's in queue, or if you're fortunate, you'll have a continuity relationship with your own provider. But what people really want, and where stage 9 goes, is This will allow people with specific issues to be able to select providers that match their needs, whether it's gender, whether it's the number of years in practice. Some people want more experienced people, or some people want younger people who've come out with new medical knowledge out of medical school or out of any other type of professional training. Stage 10 is bringing the testing right into your telehealth platform. TytoCare is beginning to do this through partnerships, things like strep testing and other types of testing. And telehealth systems in the future will be able to provide this type of testing either through a telehealth platform or through ancillary devices that will be able to do the testing at home, whether they're blood or saliva based or other types of diagnostic testing, even urine based testing. So stage 11 is using artificial intelligence to enhance the ability to do better and more precise diagnosis and therapy. Stage 12 is really navigation. Your telehealth system becomes your GPS system, your Google Maps of healthcare, where it begins to start telling you where you are. That's important in your health journey, but where you need to go next and what type of tools, what type of tests, what type of providers, what's the right setting, how do you get the right type of health through your telehealth system. This is really where I think healthcare is headed. And the final stage, stage 13, is what I call automation. This is where your telehealth system really gets programmed to be somewhat automated. It has your genomic sequencing, it has your genomic test results in it. So it knows who you are and knows exactly how your body is going to respond. Using nanobots that can be in the body connected to the telehealth system, using targeted population health approaches that are automated to identify using telehealth populations of patients that need interventions or could be helped either on prevention or in therapies. This is where the telehealth platforms of the future are going to go. So thank you very much. Glad to have the chance to be here for this very exciting next time that during this seminar and webinar.